Assessing newborns and infants. Next po. Caitlin weight 8 lb 10 OS or OZ and was appropriate for gestational age. Caitlin is a healthy term infant with molding of the head along with a cephalohematoma noted on her right anterior scalp. She was discharged to home from the hospital at approximately 36 hours of age and has been weighing approximately 8 to 10 diapers a day and stooling to 2 to 3 times a day also. Next po. So for physical development, skin, hair, and nails, at birth, the newborn skin is smooth and thin. Combined with the skin's inability to contract and shiver results in an effective temperature regulation. After birth, the newborn's sebaceous glands are active because of high levels of maternal androgen. Head and neck. At birth, the head circumference is greater by 2 cm than that of the chest. Newborn skull is typically asymmetric plagiocephaly because of molding that occurs as newborn passes through the birth canal. Next po. So for the head and neck, at birth, the head circumference is greater by 2 cm than that of the chest. And newborn skull is typically asymmetric plagiocephaly because of molding that occurs as newborn passes through the birth canal. For eyes, the iris shows little pigment and the pupils are small. What is absent at birth develop at 4 months and is mature with 8 months. Slab ability developed by 8 months. Next po. And for ears, newborns can hear loud sounds at 90 decibels and react with the startle reflex. They respond to low frequently sounds such as a heartbeat or lullaby by decreasing, crying and motor movement. The eustachian tube is wider, shorter. And for mouth, throat, nose, and sinus, newborns can hear loud sounds at 90 decibels and react with the startle reflex. They respond to low frequency sounds such as heartbeat or lullaby by decreasing, crying, and motor movement. The eustachian tube is wider and shorter. Next po. And for thorax and lungs are small and cannot be examined until they develop. The decrease in pulmonary pressure doses the foramen ovule, increasing oxygen tension and closing ductus arteriosus. For breast, two breasts develop along the thoracic ridge, the other breast along the milk-line atrophy, they are usually flat and remain so until puberty. Next po. And for the heart, blood is shocked by the foramen oval and ductus arteriosus in the left side of the heart, and from the aorta, the foramen oval dulces with the final R due to the newly created low pressure in the right of the heart, and the ductus arteriosus do not apply about 10 to 15 hours. Although the rate reduces as the children of the ages, which have a normal heartbeat of 120 to 160 at birth, and the current performance 120 at 6 months and up to 110 from 6 months. After the year, must be the heart to the point for to enter Dusky margin on the left side of the medium-sized line. Heart sounds are also more audible in the newborn secondary to the teen subcutaneous scrape of the skin on the newborn. Next po. Peripheral vascular system. Pulses should be audible at the fourth intercostal space. Weakness or absence of femoral pulses may indicate cortation of the aorta. For abdomen, the umbilical cord is prominent in the newborn and contains two arteries and one R. Peristaltic waves can be visible in implanting and can indicate a disease or disorder. The new bottom's life is aware of 0.5 to 2.5 centimeter under the right cos margins, which will be more proportionally more space than occurs in any other time after birth. Next po. Genitalia. Mucus or bloody discharge may be noted because of the influence of maternal hormones, anus, rectum, and prostate. In boys, the prostate gland is underdeveloped and not palpable. Musculoskeletal system, the feet should come to the normal position with is by the examiner. The hips should also be checked for dislocation and ease of movement by performing the Ortolani test and Barlow's sign. The spine has a single shape curve at birth. Next po. And for neurological system, the neurological system is not fully developed at birth. As myelinization develops and his number of brain neurons wrap the 30 time of pregnancy through the first year of life, voluntary control and advanced cerebral features appear, and the more primitive reflexes reduce or disappear. For motor development, gross motor, by 3 to 4 months, there is almost no head lag and and the infant may push up to prone position, displays gross motor development of the infant. Next po. Fine motor. 5-month-old information can understand freely, and 7-month babies can hand over handers. Sensory perception development. Visual. The newborn's visual impressions and focus and the ability to disguise between colors is not developed until approximately 8 months of age. Then for auditory, newborns can disguise sounds and turn toward voices and other noises. They may be very familiar with their mother's voice, and other sounds gradually gain significance when associated with pleasure. Next po. For olfactory, smell is fully developed at birth, and two-week-old infants can differentiate the smell of their mother's milk and parents' body odors. For tactile, touch is well developed at birth, especially the lips and tongue. Touch should be used frequently because infants enjoy rocking warm and cuddling. Infants normally attend to the human voice. Next po. For cognitive and language development, crying is the first means of communication, and parents can usually differentiate cries. Crying begins by 1 to 2 months laughing and babbling by 3 to 4 months, and consonant sounds by 3 to 4 months. Behaviors affect infant moral development. Parental discipline patterns may start with the stern discipline, and withholding love and affection may development infant in the form of interventions for crying behaviors. Affect infant moral development. Next po. For psychosocial development, in this stage, infant birth to 1 year is termas versus mistrust. This stage, the infant's significant other is the caretaking person. An infant who receives attentive care learns. Will be life is predictable and be met promptly. Psychosexual development. In this stage, meets the world by crying, testing, eating, and early vocalization zone is the mouth, form of sucking, swallowing, chewing the infant. Next po. And for normal infant nutritional requirements, breast milk is the most desirable complete food for the first months of a child's life. This amount of formula should be offered to the infant every 3 to 4 hours, approximately for 2 to 6 times a day. Solids are not recommended before 4 months of age due to the presence of the protrusion or sucking reflexes and the immaturity of the gastrointestinal tract and the immune system. Verify with a healthcare provider the recommended iron supplementation for the infant. This is based on prematurity, term, and feeding, and the formula contains a vitamin D, meets requirements for all breastfeed infants. Next po. And for normal infant sleep requirements and patterns, Sleep patterns vary among infants. During the first month, most infants sleep when not eating. Health assessment, collection subjective data. The nursing health history for the infant. Health assessment, collection of subjective data. The nursing history of the baby. Note that the initial assessment of a neonate occurs at birth and does not include subjective data. Therefore, parent interior is not conducted. Explain the purposes of the interview and explain any misunderstandings during this time. The unknown environment and concern for the baby, especially if the baby is sick, can cause the parents to be very nervous and anxious during the interview. Make everything in the work to prevent these obstacles. Next. Collecting objective data. Physical examination. Early detection of changes or problems in the newborn infants is important for early diagnosis and treatment. Preparing the infant and caregiver. The baby must be fully assigned in a sink or tabletop and never left unattended. Head weight and length will be measured for growth. Reflections will be evaluated by performing appropriate tests. Encourage the caregiver to ask questions during the exam. Next. So for UPGAR score, assign UPGAR scores at 1 and at 5 minutes after delivery. The UPGAR score is an assessment of the infant's ability to adapt to exerting life. Assess the following: auscultate apical pulse, inspect chest and abdomen for respiratory effort, stroke back or soles of feet, inspect muscles toned by extending legs and arms, observe degree of flexion and resistance in extremities, inspect body and extremities for skin color. For vital signs, monitor auxiliary temperature to 30 to 5. And for normal findings, the score is 8 to 10. See table 30 to 1 on, and the pulse is greater than 1 BPM, 100 BPM. The newborn is crying. The extremities are flexed and you note active movement. The full body should be pink acroyonosis. And for abnormal findings, a score of less than 8 may indicate poor transition from intrusion to extraterrestrial life. Pulse is less than 100 BPM, indicating cardia. Absent heartbeat indicates fetal demise. The newborn has absent, slow, or irregular respirations. Delayed neurologic function may be seen in grimace, no response. Delayed neurologic function may be seen in grimace or no response. The newborn is next spot. So for assessment procedure, inspect and auscultate lung sounds, monitor respiratory rate, auscultate apical pulse. And for normal findings, rate is 30 to 60 breaths. And for abnormal findings, a rate less than 30 or greater than 60 breath. Mean is seen with respiratory distress. Next po. And measure head circumference, see instructions, and then circumference is 33 to 35.5 centimeter. Next po. So measure chest circumference, place tape measure at nipple line and wrap around infant. And circumference is less than 29 centimeter or greater than 34 centimeter. Next po. Assess for square window sign, bend the wrist toward the ventral forearm until resistance is met. Measure angle. Arm and legs are flexed. Premature newborn may have a square window measurement of less than 30 Celsius. Next po. Assess for scarp sign. Lift the arm across the chest toward the opposite shoulder until resistance is met. Note location of the elbow in relation to midline of the chest. Then the angle should be less than 100 Celsius. In premature children, elbow position is at midline of the chest of greater toward opposite shoulder. Next po. To assess for physical maturity, inspect the skin, inspect the plantar surface of the feet for creases. Inspection reveals parchment, few or no vessels on the abdomen and crackling, especially in the ankle area. In premature children, abundant amounts of fine hair may be seen on the face. Next po. So for assessment procedure, female inspect labia majora, labia minora, and clitoris. And for normal findings, female, the labia majora covers the labia minora and clitoris. Abnormal findings, female in prematurity, the labia majora and labia minora are equally prominent and the clitoris is prominent. Next po. And this is the physical maturity. Skin, lanugo, plantar surface, breast, eye, ear, genitals for male, genitals and for female. Next po.